Welcome to the deep dive. Today we're really getting into the weeds on endocrine disorders and managing diabetes. We've pulled together a ton of research, clinical notes, all that good stuff to give you the clearest picture possible of how these, well, absolutely vital systems in your body actually work.
Yeah, our goal here is to really unpack that complex dance of hormones. It's all about understanding why these internal messengers are so critical for, your overall health and just feeling well. Think of it as exploring your body's internal communication superhighway.
And hopefully by the time we're done, you'll feel much more clued in about conditions that honestly affect millions of people. You might even recognize something that clicks about your own body.
Okay, let's unpack this. So the endocrine system, we hear that term, but what is it exactly? How does this whole network of glands and hormones actually, run the show? That's the perfect starting point. Essentially, the endocrine system is like your body's long-term regulatory network. It's made up of different glands. Mm-hmm. These glands produce hormones, which are chemical messengers, and release them straight into your bloodstream. Then they travel to specific target cells or organs and give them instructions controlling everything from, say, metabolism and growth to mood and how you handle stress. It's a really intricate behind-the-scenes operation.
Right, constantly working. And a huge player in that system is the thyroid gland, the metabolism maestro, as some call it. Yeah. Those main hormones, T3 and T4, they're just central to how our cells use energy, aren't they?
Absolutely central. And when the thyroid's function goes a bit haywire, you generally see two main issues. First, there's hypothyroidism. That's when your thyroid isn't making enough hormone. People often know the symptoms, like gaining weight unexpectedly, feeling cold. But what's really key is that often the underlying cause is Hashimoto's thyroiditis. That's an autoimmune condition where your body attacks the thyroid. So you're not just low on hormones, there's an immune component. Management usually involves levothyroxine synthetic T4, and it's really important, crucial actually, to start with low doses, especially for older adults or anyone with a heart condition, to avoid putting extra strain on the heart.
Okay, so if you're feeling sluggish or maybe, unusually sensitive to cold, it might be more than just feeling a bit off. It could be a signal from that maestro.
Definitely. And then you've got the flip side. Hyperthyroidism. The thyroid is overactive. This is commonly caused by Graves' disease, which again is autoimmune. Symptoms here might be weight loss, even if you're eating a lot and feeling hot all the time, really intolerant to heat. This one's best managed by an endocrinologist, a specialist. Treatments can range from meds like PTU or methimazole to radioiodine therapy or even surgery. We also sometimes use beta blockers just to help manage the immediate symptoms like a racing heartbeat.
Wow, it's amazing how such a tiny gland can have such a massive effect on how you feel every day. But it's not just the thyroid, right? There are other, even smaller players, like the parathyroid glands, often overlooked, but vital for calcium.
Oh, absolutely vital. The parathyroids, usually 4 tiny glands near the thyroid, secrete parathyroid hormone, PTH. And PTH is the master regulator of calcium and phosphate levels in your blood. This balance is critical, not just for strong bones, but for nerve function, muscle contraction. Everything from your heart beating to thinking relies on the right calcium levels.
So hyperparathyroidism, an overactive parathyroid that leads to high calcium levels. And what's fascinating there, as you mentioned, is that finding high calcium should always trigger a check of PTH levels. Is that right? Exactly.
It helps figure out if the parathyroid is the source. And it's also important because sometimes elevated calcium isn't the parathyroid. It can occasionally be a sign of an underlying malignancy, a cancer somewhere else. So it really emphasizes why you need a thorough workup. It shows how one lab value can point in very different directions, connects the dots,
That's a really important perspective. Okay, so we have the thyroid controlling metabolism, parathyroids handling calcium. What about the adrenal glands? Sitting on top of the kidneys. They're famous for the stress response, the fight or flight. But they do more than just that, don't they?
Oh yeah, they're multitasking powerhouses. Adrenals produce hormones for stress response, yes, but also blood pressure regulation and electrolyte balance, like sodium and potassium. 2 key disorders really highlight their importance. First, Addison's disease. That's primary adrenal insufficiency. Basically, the adrenals don't produce enough cortisol. This can cause symptoms like severe weakness, fatigue, low blood pressure, and sometimes a really distinct skin darkening, like a tan. Treatment involves replacing those missing steroids.
And the opposite, too much cortisol.
That would be Cushing syndrome. Way too much cortisol. Now, this can happen because of a tumor on the adrenal or pituitary gland, but very often it's actually caused by taking high doses of steroid medications for other conditions over a long time. The physical signs are quite distinctive: a rounded moon face, a fat pad on the upper back, often called a buffalo hump, easy bruising, fragile skin. And this really raises an important question, doesn't it? About how external things, like medications, can profoundly mess with our internal hormone balance. It's a good reminder of how sensitive the body is.
Definitely. Now, sticking with the adrenals and that fight or flight response, what happens when that system goes completely haywire because of something inside the gland? I'm thinking about pheochromocytoma. That sounds pretty dramatic. How does that work?
Oh, pheochromocytoma, yeah, that's definitely dramatic. It's a rare tumor, usually in the adrenal medulla, that turns out huge amounts of epinephrine and norepinephrine, those adrenaline hormones. So when this tumor decides to release hormones, it triggers these intense episodes, these waves of symptoms. We're talking sudden, severe high blood pressure, pounding headaches, drenching sweats, heart palpitations, intense anxiety. It can feel like a panic attack on steroids, basically. And because these symptoms can come and go and mimic other things like anxiety disorders or heart problems, it can be really tricky to diagnose. Treatment ultimately involves surgery to remove the tumor, but you need careful medical management, especially blood pressure control, beforehand.
It's incredible how specific these issues can be, yet have such wide-ranging effects. And, we've mentioned it a couple times already with Hashimoto's and Graves'. This theme of autoimmunity seems to run through quite a few endocrine and related disorders.
It really does. Autoimmunity, where your immune system mistakenly attacks your own body tissues, is a major factor in many conditions we discuss. We saw it with the thyroid, right? Hashimoto's and Graves', but it's broader than that. Many conditions classified as rheumatological disorders involve inflammation, and many of those are autoimmune at their core. Take lupus, for example. That's a systemic autoimmune disease. It can affect almost any part of the body: joints, skin, kidneys, brain. Symptoms can include joint pain, fever, fatigue, and that classic butterfly-shaped rash across the face. Or Sjogren syndrome, that's another autoimmune condition, but it primarily targets the glands that produce moisture, the salivary glands and the tear glands, leading to really dry eyes and dry mouth. Management for Sjogren's is often supportive, focusing on relieving the dryness symptoms.
So, while maybe not strictly endocrine glands themselves, lupus and Sjogren's show that same pattern of the immune system causing problems. Much like with autoimmune thyroid disease, it really drives home how complex the immune system is and why getting these diagnoses right early on is so important. Okay, let's connect this now to, a huge health issue worldwide. Diabetes mellitus. It's incredibly common. Affects, over 11% of people in the U.S., and those numbers have shot up over the last 20 years or so. We should probably focus our deep dive on the two main types, type 1 and type 2.
Sounds good. Let's start with type 1 diabetes. This is fundamentally an autoimmune disease. The body's immune system specifically targets and destroys the beta cells in the pancreas. Those are the cells that make insulin. So people with type 1 develop an absolute deficiency of insulin. They need external insulin to survive right from the get-go.
And the classic symptoms, the 3 Ps, polyuria, being a lot, polydipsia, being incredibly thirsty, polyphagia, being excessively hungry. Those are key signs. But other things like weight loss, blurry vision, and the big risk, especially at diagnosis, is diabetic ketoacidosis, DKA. That's a medical emergency, right? Where the lack of insulin causes dangerous changes in body chemistry.
Exactly. DKA is life-threatening. Diagnosis for type 1 usually involves blood sugar tests, of course, but also checking for specific islet autoantibodies. These confirm that autoimmune attack. And treatment, as I said, is lifelong insulin therapy. It's complex, requires careful monitoring and adjustments, usually managed by an endocrinologist.
Okay, now shifting gears to type 2 diabetes. This one's different, isn't it? It's more about the body not using insulin properly, initially at least. It involves decreased insulin secretion eventually, but also significant insulin resistance. The cells just don't respond well to the insulin that is there. And obesity is a huge risk factor.
That's right. Insulin resistance is key in type 2. And what's tricky is that early on, type 2 might have no symptoms at all. This is why it can sometimes go undetected for years, while, underlying damage might still be occurring. When symptoms do show up, they can include those 3 Ps, like in type 1, but also things like fatigue, maybe recurrent skin infections, wounds that heal slowly, and sometimes a skin sign called acanthosis nigricans, those dark, velvety patches, often on the neck or armpits.
Which is precisely why screening is so important for type 2. The recommendations now are generally to start screening around age 35, right? Or even earlier if someone has risk factors like obesity, family history, certain ethnicities. And the tests used are typically the A1C test, which gives that 3-month average blood sugar, or a fasting blood glucose, or sometimes an oral glucose tolerance test.
Correct. And when it comes to managing type 2, if we connect this to the bigger picture, the foundation is always lifestyle changes. Diet modifications, increasing physical activity, weight loss if needed, these are paramount. Metformin is very often the first medication started, usually right along with those lifestyle efforts. It mainly works by reducing glucose production by the liver and improving the body's sensitivity to insulin.
And if metformin and lifestyle aren't enough, or maybe aren't tolerated, what other kinds of medications are commonly used? There seem to be quite a few classes now.
Oh, there are many options, which is good because we can tailor treatment. You have sulfonylureas like glipizide or glyburide. They push the pancreas to release more insulin. The main watch out there is the risk of hypoglycemia, low blood sugar. Then there are GLP-1 receptor agonists. These are injectables mostly, sometimes oral now. They help lower blood sugar, but many also offer heart benefits and often help with weight loss, which is a huge plus. SGLT2 inhibitors are another class. They work in the kidneys, making you excrete more glucose in your urine. A potential side effect is increased risk of urinary tract or yeast infections. TZDs, thiazolidinediones, that improve insulin sensitivity in muscle and fat cells. But a key point with these is they can cause fluid retention, so they're generally avoided in people with heart failure. That's a contraindication. And DPP-4 inhibitors, they work through a different pathway involving incretin hormones to help control blood sugar.
So, a lot of tools in the toolbox.
Yeah.
And insulin itself. That comes into play for type 2.
Insulin is considered for type 2 when A1C levels stay high despite using other medications. Or if someone's A1C is very high at diagnosis. Or, if there are signs the pancreas's ability to make insulin is really declining significantly.
Right. And speaking of insulin, managing it can be tricky. There are those two phenomena that often cause confusion. The Somogyi effect and the dawn phenomena. They both can result in high morning blood sugar. But they're different problems, aren't they? How do you tell them apart?
Yeah, this is a classic point of confusion, but getting it right is crucial because the fix is different, often opposite. The Somogyi effect is basically a rebound high. It happens if blood sugar drops too low overnight, maybe from too much nighttime insulin or skipping a snack. The body panics, releases counterregulatory hormones like adrenaline and glucagon, and overshoots, causing high blood sugar by morning. So the root cause was actually a low. To fix Somogyi, you might need to reduce the nighttime insulin or add a snack.
Okay, so the body's overreacting to a dip. What about the dawn phenomenon then?
Dawn phenomenon isn't preceded by a low. It's a natural rise in blood sugar that happens in the early morning hours for many people, including those without diabetes, but it's exaggerated in diabetes. It's driven by the normal overnight release of hormones like growth hormone and cortisol that tell the liver to produce more glucose to prepare for the day. It's just a steady climb, usually starting around 3 or 4 a.m. So for dawn phenomenon, the treatment might involve increasing nighttime insulin, adjusting timing, or maybe changing the type of insulin used. What's fascinating, really, is needing to figure out which one it is, usually by checking blood sugar in the middle of the night, like 2 or 3 a.m., to know how to adjust treatment correctly.
That makes sense. Ultimately, though, managing diabetes isn't just about hitting specific blood sugar numbers on a meter, is it? It's about preventing the long-term damage.
Absolutely. That is the critical long-term goal. And these complications, they often develop silently over years. It's the cumulative effect of elevated blood sugar, even moderately elevated, that damages blood vessels and nerves. We group them into microvascular, affecting small blood vessels, and macrovascular, affecting large ones. Microvascular includes neuropathy, nerve damage, very common in the feet, which is why regular podiatrist visits are essential for foot care. Also retinopathy, damage to the blood vessels in the retina of the eye. Requires regular eye exams with an ophthalmologist to catch and treat it early, prevent vision loss. And nephropathy, kidney damage. That's why annual urine tests for microalbumin are recommended to detect early kidney damage. Then the macrovascular side, the big vessel problems. Diabetes significantly increases the risk for coronary artery disease leading to heart attacks. Also hypertension, high blood pressure, stroke, and peripheral artery disease. So managing diabetes effectively means not just controlling blood sugar, but also aggressively managing blood pressure and cholesterol levels. It's a package deal to reduce those major risks.
It really underscores that this isn't just about one number or one organ. It's about protecting the whole system, isn't it? Safeguarding everything from your nerves and eyes to your heart and kidneys. Well, this has been quite the deep dive. We've journeyed from the intricate workings of the endocrine system, the thyroid, adrenals, parathyroids, all those crucial players, all the way to the complexities of diabetes, a condition affecting so many. It really brings home how interconnected everything is inside us.
It really does. And I hope listening gives you a bit more appreciation for just how complex, but also how resilient the human body is. And for all that silent, constant work the hormones are doing behind the scenes every single second. It's quite remarkable, really.
It definitely makes you think, doesn't it? How much of our day-to-day feeling, our energy, our long-term health is being directed by these quiet internal conversations? And maybe, just maybe, understanding them a little better. What could that empower you to do for your own well-being?